Well, robots are taking over many industries, and now we're seeing them in the medical field. They're being incorporated into the operating room, actually performing surgery on patients.
Yeah, a Long Island woman says it saved her life from breast cancer, and she says it was even her idea to go under the knife by the robot. PIX11's Michelle Ross has a story from Glen Cove Hospital.
Mary Leonardi has a history of breast cancer in her family and has been monitoring her health since being diagnosed with Lynch syndrome in 2007, a genetic disorder that makes her more susceptible to breast cancer.
Because of my Lynch, I've been heavily screened, tested, probed and prodded for 15 years of my life in anticipation of preventing early cancers.
After surviving thyroid cancer and a hysterectomy, she decided to undergo a double mastectomy to be safe. When it came to breast reconstruction, she didn't want implants. Instead, she wanted something more natural, like her belly fat tissue, and for the surgery to be performed by a robot.
And I said, I don't do that, and I almost dismissed that.
Mary had prior experience with robotic surgery with her hysterectomy, but Dr. Tanna of Glen Cove Hospital denied the idea, until a few years later when he attended a lecture by Jesse Selber from Texas, who had experience with it.
I was blown away, and I was like, not only is he right, but Mary's right for wanting this. And that's the resilience to the story. That's the empowerment to the story, because she didn't give up.
Dr. Selber flew in from Texas, and with the assistance of the robot, they successfully completed the 8-hour operation earlier this month. A surgeon guides the robot from the console, but the robot is the one actually touching the patient and performing the operation at the direction of the surgeon. The groundbreaking technology is the first on Long Island and first major advance since it was developed more than 25 years ago.
Very few teams have been able to put together a well-rounded group of people that have the capabilities to accomplish this, and so I'm really happy for the Glen Cove team.
The doctors say the benefits include a reduced risk of abdominal hernia and bulge, reduced pain, and quicker recovery time.
I want all women to have all choices, an abundance of choices. We shouldn't be limited in our options for something as major as breast reconstruction.
And since Mary's operation, 2 additional patients have also undergone the breast reconstruction surgery with the robot, and many more patients are lined up. At Glen Cove Hospital, Michelle Ross, PIX11 News.